Dispatch has sent us to the scene of a 58-year-old male having chest pains. His son also states that he has a history of heart problems. EMTs arrive on the scene. Personal protection is on and BSI good. Scene is safe. The nature of injury is patient, 58-year-old patient with chest pains and a history of heart conditions. There's only one patient. We may need additional assistance from ALS. We'll wait and see. And there's no need for spinal immobilization.
Oh, I've got chest pains. It hurts. Lots of pressure under there.
Depression is a 58-year-old male, good looking, but with chest pains, complaining of pressure on his chest. Look around, I see some medications on the counter. I'll check to see what those are, get a history on that. He is talking, a little bit raspy voice, and seems to be oriented. Sir, could you tell me what issues you're having at this point?
Oh, started having chest pains about 2 hours ago. Feels like there's an elephant sitting on my chest.
Able to communicate his chief complaint. His mental status is alert and awake. Airway seems to be open. He is able to speak. Breathing seems to be normal, and his circulation seems to be okay with the pulse. Skin's a little bit clammy, and there's no bleeding that I can see. I'd like to know if you or your son could give me a brief history of your medical conditions.
Well, I've been having heart problems for about the past 5 years. I've been able to take nitroglycerin, and I've taken 2 nitroglycerin under the tongue already. I have high blood pressure medication. I also can't remember the name of the drug take for my heartburn that I have. And that's about it.
Thank you, I appreciate that. I understand that you've taken 2 nitroglycerin. Anything else that you've taken? Patient nods no. All right. Well, I think we're going to get ready to load you up and get you headed to the hospital bit. In the meantime, while that starts getting ready, we're going to like to expose and do some more in detailed inspection. I'd like to get your vitals. If I could get a blood glucose from you. And also I'd like to put a pulse ox on the tip of your finger. I'm going to take your radial pulse. Seems to be a bit fast. And then we're going to move, skin's a little clammy, a little pale and cool. Okay, we're going to take your blood pressure. It's 150/75. Could be a little on the high side, but we'll see. Okay, I'm also going to take a stethoscope and check your chest sounds, respirations, breathing sounds, and possibly hook up an EKG. I'm going to go ahead and do that. Eyes are dilated, and the same. And if we could get your temperature. Sir, if I could get a little more detail from you on some of these issues. I'd like to know when this exactly started happening, if you were doing anything that provoked this event, what the quality is of this, the chest pains that you're having. Is it just in your chest? Does it travel anywhere else? If you could let me know that. And a scale of 1 to 10, what the severity is, and how long do these pains last, or is it constant? Okay. Do you have any allergies that you're taking medication for? Are you allergic to anything? Anything else on your medications history that I should know about? And when was your last pill besides the nitroglycerin that you took? All right. So after all that, don't see any other reason. The head, everything else looks fine. Neck, chest, abdomen, no pain in your abdomen, pelvis. Experience, you can feel my touch on your arms, on your fingers, in your toes, all that's fine. Okay. Based on all this information, we're going to go ahead and give you an aspirin. You can take and chew this. We're going to give you 3 81 millimeter aspirins since you're awake and alert. So just want to make sure we got the baby aspirin. They are the 81 grams. So it's the right, and we have the right patient here, the man in the chair with having the chest pains, have the right medication, and the dose, we're going to go ahead and give him 3. By mouth chewing at 6:06 p.m. and I'm going to document it on all of this information on our time. So go ahead and take that, sir, and we are going to load you up and get you to the hospital, and we'll consider the other nitroglycerin pill if this continues.